Hello everyone, it's Melissa Sweet here, public health journalist from Croakey. We're on a Croakey Go on a beautiful morning in Sydney and delighted that we have with us here Professor Stephen Leeder, Emeritus Professor of Public Health. But that doesn't mean you're retired, does it, Professor Leeder, because we know you're still very active. Would you like to tell us a bit about what your day job is now?
My day job has two bits. The first of those is working at Westmead Hospital in the Western Sydney Local Health District, where I oversee the development of research and education, especially in the redevelopment of Westmead, which is underway at present. And the other is that I edit the International Journal of Epidemiology. So that's my two day jobs.
We've just had a beautiful walk through the grounds of Callan Park, the grounds of an old psychiatric institution. Walking through trees, grassy areas, past old buildings, hearing some of the history, an opportunity to reflect on contemporary health policy as well. And very keen to hear your thoughts on the recent federal budget, what it might mean for our health.
Very difficult to say, Melissa, because there's not much that stirs the heart or makes the spirit sing. It's incremental, and one of the increments is increasing out-of-pocket expenses for everybody, which I share the view with many others that this constitutes the biggest threat to Medicare, because we're busily shifting the cost of healthcare out of the publicly funded sector into the back pockets of people. And there is, of course, a differential ability to meet those costs, and the maximum impact of out-of-pocket costs is on those who can afford them least.
Steve, this is Leslie Russell. What do we do about getting some innovation in the way that healthcare is funded in particular, but delivered as well? What's it going to take?
When it comes to innovation in healthcare, I think the best opportunity we have is through programs that integrate community and hospital care for people with serious and continuing illness problems, especially older people with multiple morbidities. And we see some breakthrough there with hospitals reaching out to the community, general practitioners, and agreeing to share resources, and general practitioners at least considering the idea that not all healthcare has to be delivered on a fee-for-service basis. That's a break point as far as I can see in Western Sydney. I don't see much other hope, but as people learn that it's better to have a single source of resources for the people with the chronic problems, distributed sensibly between hospital and community, people are learning some new behaviours. But as a point of ideological proposition, no joy. And the Australian Medical Association breaks out in a malaria-like fever every time anybody suggests, oh, the end of fee-for-service, oh, no. But it surely should be, use the old aphorism, horses for courses. You don't need integrated care, and you can use fee-for-service for common colds and cuts.
Do you think what's going on in Western Sydney, where there's this little, seems to be a little pocket of innovation, that a movement from the ground level up with something like Western Sydney as an exemplar might be the way to drive things forward in the absence of leadership from the top down?
Well, that's certainly my cherished hope. And I think there are grounds for hope, because the big epidemiologic transition from episodic acute care through to continuing chronic care, coming whether we like it or not. I mean, you've only got to wander through the wards of Westmead Hospital, or indeed even the corridors in the emergency department, to see that the vast majority of people are old and are multiply infirm. And we're still in the business of band-aid treatment. But there's a level of professional dissatisfaction that people can put up with, doctors and others, before they say there must be some other way of doing this. And the virtue of having what Gillian Skinner established in New South Wales as, oh God, there's a lot of air traffic today.
Just wait till the plane passes, I think. So
yeah, think of all that fossil fuel being spread over us. But Gillian Skinner had the vision that she would establish, as you've suggested, Leslie, a series of exemplars. One was in Central Coast around Gosford, Newcastle. Another was in the far west of New South Wales around Dubbo, Orange, although it's not actually far west, I suppose. And another based around Westmead. And these were funded for 3 years to integrate care between hospital and community, and no one would freak out if a state dollar got spent in general practice.
And are we going to see evaluations from those projects? They must be close to winding up.
Yes, they're close to winding up, and there's an evaluation report from the Western Sydney project, I don't know about the others, about to go to the board of Western Sydney. A report that I know intimately because I happen to help write it. But in addition, some of the clinicians in diabetes, Professor Wai Chung and others, have put together an evaluation strategy to look at harder markers. We were very concerned from my side about the process. How did people, particularly clinicians, find this new way of operating? Because if they believe it's just a waste of time, then it's a waste of time. So we were concerned with the process of consumer and practitioner. The real test of these sort of projects is their sustainability.
Yes. So what happens at the end of the pilot project?
What happens at the end of the pilot? So we've been busily lobbying the local health district to take on the funding of this, but there's more to it than that. You've got to have the same level of commitment. Cautiously optimistic. It's worked well. People have enjoyed participating in it, and it's cut down on excessive use of or inappropriate use of the emergency department, as people have found other ways of handling flare-ups. So all in all, a good news story.
As we're sitting here, there's people cycling and running past, there's lots of cars, we've had a few planes going over.
Yeah.
All a reminder, as you said, about the wider policies that affect our health, for example, fossil fuel consumption. Would you like to comment on health and all policies in the budget? What will be the impact of wider policies upon the community's health?
There's no doubt that you could transact a very comprehensive national health policy that paid due attention to the factors in society that determine our health. I mean, the reason we have people jogging by here or walking by here or flying overhead is that they can afford to. There are a lot of people who can't afford that. So I'm not saying therefore you've got to pay for everybody to go jogging, but you do need to be sensitive in a health in all policies approach to the fact that much of health is determined by factors outside the healthcare system. Not that the healthcare system itself is outside those determinants either, because depending on where you go, you'll get better quality care, and the degree of affluence of the surrounding community will determine that quality of care. So what would I like to see? I'd like to see a national health policy that could be initiated within the health portfolio, but would spread to include education, social welfare and social support, an approach to carbon, all of those sort of things.
What do you think it will take to get that? Because I guess in a sense that's a message we might have been hearing for some years, possibly even decades, now, and there's been very little political engagement.
There has been very little engagement. A question that I constantly ask myself about Western Sydney, and in dialogue with Don Nutbeam, who's a great advocate for health literacy, we're I think inclining to the view that part of the health literacy that we need to encourage in the community, God knows it's pretty low with regard to even basic things like how to cook a healthy meal, but beyond that, how are we going to get political change? We'll get political change by energising the community. And if you think back on tobacco, a lot of the legislative and economic changes that are underpinned a reduction in tobacco consumption, like ceasing to advertise, taxing, people being offended by the people smoking around them, that is a community movement, so that politicians seeking to represent the community then have to take that into account. So that's a gradualist approach. Perhaps the realist approach that would come from others is to say, until you get a crisis, nothing's going to happen. And I don't know what the crisis would be, frankly, but could be a major meltdown in health, could be an economic upheaval, could be a nuclear exchange.
War leads
Yes, something like that might carry in its train. I hope we don't have to get to that point, but it may be we do. As with the National Health Service in the UK, followed hard on the heels of World War II. People said, enough. This business of shooting one another in trenches is over. We've got to look after one another. And so Bevan and others were able to introduce the National Health Service. But without that crisis, it probably never would have come about. But I think we can hope for better things. As in Western Sydney, for example, as the level of affluence rises, there's a degree of linguistic familiarity homogenises, because at the moment half the people who got there were born outside Australia, so their world views and all the other things are very different. If we can unite people around saying you've got to attend to the environment if you want better health, and you've got to tell that message to the people in power, because you can't, we can stir the pot at a local level, we can energise groups to do things like, we've seen with Cullen Park and the citizens of Balmain and Rozelle, who have been very articulate in campaigning to prevent this becoming another developmental fiasco. But they're very literate people. They understand health, they understand the social determinants of health. They have the power, economic, educational, personal, to influence their environment. And that's the sort of thing we've got to get through, I think, to places like Western Sydney.
So just to wrap up here, we've had people participating on Croakey Go online as well as in real life. So what would be your sort of call to action to people who are engaged enough to participate in Croakey Go? Like, what can we do? What would you urge us to?
Well, I think we've got to remember that the power of one, the power of an individual in a community to energise it, to take action. And so things like the Cullen Park preservation is symbolic. It says to a community, you can take, with effort, you can take control of things. And I would hope that in, say, places like Western Sydney, we can support, encourage, facilitate greater involvement in the community and the debate about the social factors that influence our health, and an insistence coming from grassroots to politicians to smarten up. Growth and jobs. How destitute is that in terms of a national vision? And so we need people going to stand up and say, our principal interest is in the health and welfare of Australian communities, and to achieve that we need a multi-pronged approach that involves all of government, and all of the community. That's what's really needed.
So I guess jobs and growth is a slogan that sticks. It's repeatable ad nauseum. What's your alternative slogan then? Something simple, snappy, something people will relate to.
The determinant, well, I would say health is for everyone, not just to grab, but to create. So it's a question of privilege, and it's a question of access, but it's also a question of what are you going to do about it? As an empowered individual, what is going to be your contribution? You're going to work with a local group to develop more green spaces, safer walk spaces and the rest of it. And beyond that, is there something that you can do to convince your political representatives in this functioning democracy that they're not taking your basic concerns seriously? So those would be the things that I would hope for.
Thank you very much, Professor Stephen Leeder. It's lovely to see you out in Sydney.
Thanks, Melissa.